place a limit on how much you can be charged for out-of-pocket expenses, because in the United States of America, nobody should go broke because they got sick. No extra charge, routine checkups and preventive care like mammograms and colonoscopies, because there's no reason we shouldn't be catching diseases like breast cancer or colon cancer before they get worse. That makes sense to save money so far. If you're one of the tens of millions of Americans who don't currently have health insurance, the second part of this plan is going to finally offer you affordable choices. So if you lose your job and change jobs and want to start a business, you'll be able to get coverage. You will have confidence that affordable coverage is out there for you. And we will do this, not contrary to what folks say, by some government takeover of healthcare. We will do this by setting up a new insurance exchange, a marketplace where individuals and small businesses will be able to shop for an affordable health insurance plan that works for them. And because there'll be one big group, these uninsured Americans will have the leverage to drive down costs and get a much better deal than they get right now. That's how large companies do it. That's how government employees get their health insurance. That's how members of Congress get good deals on their insurance. You should get the same deal that members of Congress get. If you still can't afford the lower price insurance available in the exchange, we're going to provide you or a small business owner tax credits so that they can do it. And the first few years that it takes to set up the exchange, because it will take a few years to get this all set up even after it passes. But in the meantime, we want to make sure people get some immediate help. So we're going to immediately offer Americans with pre-existing conditions who can't get coverage right now, we want to give them some low-cost coverage that will provide them protection from financial ruin if they become sick. I've also said that one of the options in the insurance exchange, most of the folks who are going to be offering insurance through the exchange are going to be private insurers. You know, Blue Cross Blue Shields, Aetna, all these. But I think one of the options should be a public insurance option. Nobody would be forced to choose it. No one with insurance would be affected by it. But what it would do is it would provide more choice and more competition. It keeps pressure on private insurance to keep their policies affordable, treat their customers better. I mean, think about it. It's the same way that public colleges and universities provide additional choice and competition to students. That doesn't inhibit private colleges and universities from thriving out there. The same should be true on the healthcare front. Minnesota, I have said that I'm open to different ideas on how to set this up. But I'm not going to back down from the basic principle that if Americans can't find affordable coverage, we're going to provide you a choice. And I will make sure that no government bureaucrat or insurance company bureaucrat gets between you and the coverage that you need. That's a promise. this plan sounds pretty good, or when you're talking to your friends or neighbors, they might say, yeah, that sounds all right, but let me ask you this, how are you going to pay for it? And that's a legitimate concern. We inherited some big deficits. And some big debt. And we've had a big economic crisis that has required us to take some extraordinary steps. So we're going to have to get control of our federal budget. We have to do it. So it's a legitimate question, but here's what you need to know. First of all, I will not sign a plan that adds $1 to our deficits, either now or in the future. Part of the reason that I face these trillion-dollar deficits when I walk into the door at the White House is because there were a lot of initiatives over the last decade that weren't paid for, from the Iraq War to tax breaks for the wealthy. I will not make the same mistake when it comes to health care. Paid for by finding savings within the existing healthcare system. Money that's already been spent, but spent badly, wasted, and abused. Right now, too much of your taxpayer dollars and too much of your savings plan are spent on healthcare that doesn't make us healthy. That's not my judgment. That is the judgment of medical experts and doctors and nurses, healthcare professionals all across the country. We love nurses. I love them. As I said on Wednesday night, this is also true when it comes to Medicare and Medicaid. And Medicare is one of these issues that has been, really distorted in the debate. So I spoke directly to seniors on Wednesday. I want to repeat what I said. We have stood up for 4 decades for the principle that after a lifetime of hard work, our seniors should not be left to struggle with medical bills they can't pay. That's how Medicare was born. It remains a sacred trust. It needs to be passed on from one generation to the next. That's why not $1 of the Medicare trust fund will be used to pay for this plan. Not $1. We will not be lowering benefits for senior citizens. The only thing that we will be doing is eliminating hundreds of billions of dollars of waste and fraud, as well as subsidies that are going to insurance company HMOs. The other thing we want to do is we want to create an independent commission of doctors and medical experts charged with identifying more waste in the years ahead. And that's going to ensure that Americans, seniors, get the benefits that they've been promised. We'll ensure that Medicare is there for future generations, and we can use some of the savings we get to actually fill the gap of costs on prescription drugs that so many seniors are struggling with. We can save them thousands of dollars on prescription drugs.